In most developing countries, public procurement constitutes an average of about 5% of the GDP, as well as about 20% of the public expenditure. In 2019, procurement of goods and services constituted about 3.94 billion Zimbabwean dollars, while capital expenditure was 7.02 billion Zimbabwean dollars. This means that about 11 billion Zimbabwean dollars, representing almost 50% of total expenditure, was disbursed through the country's procurement system. With 6 central hospitals, 7 provincial hospitals, 6 to 4 district hospitals, and at least a healthcare institution in every one of the 1,200 wards in Zimbabwe, and a complex web of activities including procurement and dispensing of the primary commodity, drugs. The Zimbabwe health system requires comprehensive administration that promotes transparency and accountability. Healthcare received 11% of 473 billion Zimbabwean dollars of the total budget in the 2023 budget statement, ranking second only to primary and secondary education. Development partners invested a total of $408.3 million in the health sector in 2022, with an estimated $212.9 million United States dollars planned for 2023. A large and high-volume transacting environment extends itself to corrupt activities. In 2021, the Global Fund allocated $150 million United States dollars to Zimbabwe. African Development Bank allocated $13.7 million to improve the health system and boost anti-COVID-19 efforts in Zimbabwe. In March 2022, the World Bank Group signed a financing agreement of $6.6 million for the Zimbabwe COVID-19 Emergency Response Project. The Zimbabwean government allocated an additional $100 million United States dollars in August 2021 for the procurement of COVID-19 vaccines with the goal of achieving 60% herd immunity. The U.S. Embassy contributed more than $20 million United States dollars to Zimbabwe's COVID-19 response. Transparency and accountability systems are disregarded in the name of saving lives. In such an environment, deliberate suspicious decisions and actions that result in the unexpected use of relief public resources are possible. Influential public officials, ministers, politicians, and business people are all looking for ways to divert resources for personal gain. Too many hands, too many leaks, and only a small portion reaches the intended recipients. Reduction in corruption mainly stems from the minimization of human contacts and e-procurement. E-procurement enables a more transparent and efficient information flow, improving information access for stakeholders interested in tracking transparency and the use of taxpayers' money. E-procurement reduces collusion or bid rigging by the suppliers. Relevant information is captured into a securely operated electronic system. E-procurement entails virtual automating key steps of the procurement system, making public transactions more auditable and reducing the discretionary power of public officials, the ground for petty corruption and kickbacks. Government should ensure the finalization of the foundation for e-procurement laid under the World Bank-supported EGP strategy. The government should prioritize making the current public procurement environment more conducive to e-procurement, ensuring that all necessities for full migration are in place. The government should also ensure that there is a legislative compliance for e-procurement.